Okay guys, this is a diagram where I'm going to try to highlight kind of the systemic circulation versus the pulmonary circulation. I know sometimes these diagrams aren't the best. I'm just trying to come up with new and different ways to land these concepts in an online format, kind of making it up as I go along. Thanks again, COVID. Bear with me here. Hopefully this lands. If you feel like it's not coming through and you don't understand, as always, please reach out to me. And I apologize. I feel like these recordings are a little bit jumbled. My dad in particular is having a cardiovascular surgery tomorrow, so it just seems on point that, of course, we'd be discussing issues with the system right now. So just bear with me. Okay, so looking at let's start with the pulmonary circulation, okay? And again, if you guys know the order of blood flow, this is really going to help. The pulmonary circulation technically starts in the pulmonary artery, which is this guy here. So this is your pulmonary artery. And this is going to be deoxygenated blood that is leaving your heart and going into your lungs. And when it goes into your lungs, it's going to go through this artery, this large pulmonary artery, and it's eventually going to make its way into an arteriole, which is just a smaller artery. That's all that is, that little O sound at the end, just a smaller artery. It is then going to go to a capillary. And we've seen this exact example right here. We've talked about Fick's law. We've talked about diffusions of gases. So here you have your perfusion, right? Here's your V, and here's your Q, right? Here's your perfusion coming from your heart. It's deoxygenated. It's going into your lungs. It's trying to match up with ventilation. The O2 is going to jump off your alveoli or diffuse out of your alveoli into your bloodstream, onto your hemoglobin. And your CO2 is going to leave your hemoglobin and come back over here. And we've talked about the Bohr and Haldane effect, and we've talked about all these different things. Because this is the lung, this is going to be the Haldane effect for that CO2. So I'm just reminding you that this all layers, this all builds. That gas exchange has now occurred in the capillary system, which is your exchange vessel. And now you have oxygenated blood that is going through a venule, which is just a small vein. And then it's going to make its way up to your pulmonary veins. Then that oxygenated blood is going to go back into your heart. So after it leaves your pulmonary vein and goes into your left atrium is going to be essentially the start of your systemic circulation. So once it's out of the pulmonary vein, that's kind of the end of your pulmonary circulation. And again, this is one thing I want to highlight too. Arteries are just defined as vessels going away from the heart. Veins are vessels going towards the heart. So your pulmonary artery has deoxygenated blood because it's going away from your heart into your lungs, and your pulmonary veins have oxygenated blood because that vessel is going towards the heart from the lungs. So this is your pulmonary circulation here. So it starts at the pulmonary artery and it ends at the pulmonary vein. And key notes about your pulmonary circulation, okay, that we're going to put over here, your pulmonary circulation. And I'm just going to abbreviate because the penmanship on this is tough. It is low pressure. We know this because we talked a lot about VQ mismatches and how there's regional differences in the lungs caused by the fact that it's a low pressure blood system, right? And because of that, you have a lot of blood flow that goes down towards the bases, right? So the bases of the lungs have a lot more Q, a lot more blood flow, a lot more perfusion than the apex, right? All of this is tying together. So this is your pulmonary circulation. It's a low pressure system. And when you think about the right side of the heart being the less muscular side, that has a lot to do with the fact that the right side of your heart is essentially just trying to eject blood into your lungs, which is not very far. It's pretty close together, and it's a low pressure system. So your right side of your heart does not need to be that muscular because it's this very low pressure transfer system here. So this is what your pulmonary circulation looks like. It starts at your pulmonary artery and it ends at your pulmonary vein. When you're talking about your systemic circulation, You're talking about the circulation that's going through all of the rest of your body, your fingers, your toes, your organs, your brain, all of your body, right? And so if you're talking about that, you're going to be looking at we'll start on the deoxygenated side. You're going to be looking at your inferior Vena cava down here. And I know we've done this before, so I'm going to go kind of quick. And your superior Vena cava. And those are your large veins that are going to dump deoxygenated blood back into your heart from your body after gas exchange has occurred. It's going to then dump into your right atrium. That's going to move through that AV valve, that tricuspid valve, and fill your right ventricle. All right, and this is going to happen during diastole. When your heart is nice and relaxed, all of this blood is going to fill. It's going to fill your heart as much as it possibly can. And circling back, this is also where you see that stretch of that myocardial tissue, because all of this blood volume is coming in. When it's full and you start systole, you start this heartbeat, you start this contraction. When it's full, your heart is going to contract down and it's going to eject that blood from your right ventricle into your pulmonary artery, right? So now it's in pulmonary circulation. That oxygenation is going to occur. It's going to come back into your systemic circulation. It's going to fill your left atrium, down into your left ventricle. That's going to fill. That heart's going to stretch again. And then when it contracts, that oxygenated blood that has come from the lungs is now going to eject out through your aortic artery, up here into your head, down here into your body, right? And that is going to be how the tissues get their oxygen. So you've got this oxygenated blood leaving the left side of your heart through your aortic artery. Down here, it's going to go from the artery to an arteriole, just like in the lung, but this time we're talking about the oxygenated side. This is going to be your capillary or your exchange vessel in purple, right? And what do we know is happening right here? Here's the oxygenated blood coming from the heart through the aortic artery. It is going to do what to this cell? It's going to deliver oxygen to this cell, right? And then that's going to be exchanging here. It's going to pick up CO2, and we know how. This is the Bohr effect out at the tissues. It's picked up the CO2. This blood has now deoxygenated, and it's going to go back to the heart and start the process all over again. So your systemic circulation, and we'll put that over here, systemic circulation is high pressure compared to your pulmonary circulation, and it is because your body is much bigger than your lungs. That's really as simple as it is. Your body is much bigger than your lungs. So the anatomy of the heart, and although I didn't draw it very well, the left side of your heart is 2/3 of the muscle mass. It's really the workhorse of the heart. It's where it really is the bulk of the muscle, and it's because it has this high pressure system that has to deliver blood throughout your whole body. So this is just kind of showing you the way that the pulmonary circulation and the systemic circulation are separate, and they have kind of this opposite effect, with the pulmonary artery being deoxygenated where the aortic artery is oxygenated, and the pulmonary vein is oxygenated, whereas the superior and inferior vena cava is deoxygenated. So they're essentially opposites in that way, but it is all one loop tied together. It's the things that we know to be true about gas exchange that we've already talked about in detail. If you guys just kind of practice this through in your brain a couple times, it's not too bad. I feel like my diagram probably makes it look worse than it actually is. But that is kind of where the pulmonary circulation and the systemic circulation differentiate. So pulmonary circulation starts in the pulmonary artery, ends in the pulmonary vein, and your systemic circulation is essentially everything else. We also talked briefly about the coronary circulation, and that we're not going to talk about a lot. You have to know like the 3 slides that I did, and that's just the heart basically circulating blood to itself. That's it. We're not going to go into that in detail. I don't think it's super helpful. it doesn't end up being a big part of our role as a respiratory therapist. We care more about the pulmonary circulation and some of the things that can go wrong there because it has a lot to do with the lungs, and then that obviously can trickle into the systemic. The coronary circulation is not a big part of what we do, so we're going to kind of breeze past that. Again, I just want to highlight these definitions over here. Diastole, relaxed, filling with blood. Systole, contraction, ejecting blood. Repolarize, relaxed, filling with blood. Depolarize, contraction, ejecting blood. All right. The other thing is, even though I took you in a loop from the right atrium to the right ventricle to the pulmonary artery, the thing that's important to realize is the right atrium and the left atrium, they fill simultaneously. When your heart is in a relaxed filling stage, the blood from your superior and inferior vena cava that's filling your right atrium, that's happening. At the same time, your pulmonary veins are filling your left atrium at that time as well. So your heart fills on both sides simultaneously, and then when it starts to depolarize or contract, and those ventricles go to eject blood through your aortic artery and eject blood through your pulmonary artery, that also happens simultaneously. So we follow it in this loop because it helps you to see this circle of things, but know that the right atrium and left atrium fill at the same time. The right ventricle and left ventricle contract at the same time. They eject blood through their corresponding arteries at the same time. So try to have the visual of obviously the blood flow, but also realize that these are concurrently happening. That's all I have for this diagram. I'm going to keep doing little snippets like this to try to keep tying these together. I hope it helps. If not, man, I'm sorry.